He worked as a health advisor for the UK government under the Department for International Development and the Foreign, Commonwealth and Development Office. She also briefly worked in Tanzania as a regional coordinator for the Neglected Tropical Diseases Control Program and as a medical officer. Gloria is passionate about girl education, women's health, and global health diplomacy. Let's welcome our speaker for today, Dr. Gloria Ngaiza, who will be speaking on the sub-theme, exploring the role of research in strengthening the health systems in Sub-Saharan Africa. You're welcome, ma'am.
Thank you so much, and thank you so much for that introduction. I'll try to start my video. Hi, everybody. Can you hear me?
Yes, ma'am, we can hear you.
Okay, thank you. I don't have my slides because I requested someone to share on my behalf. Is it possible to share as PowerPoint?
Sorry, please, can you see my screen?
Are you sharing it in PDF?
Yes, please.
Okay, it's okay as well. I can see a screen, but I see 2 slides at a time, but it's okay. I think we can start. No problem. So I would like to start by saying thank you so much for inviting me to speak today. And I'm happy to be here to talk to you about this very important topic. And when I was invited, I was asked to speak about health system research. And you can see that I've added policy in this topic because they go hand in hand. So the research that we do to strengthen the health system helps to also inform policy or policies in the health sector. And so I'll be discussing both of them and just trying to link them for you to understand how the use of health research can help to strengthen policy. And in my presentation, I'll start by defining the health system. I know like most of you already know what it is, but it's good for us to have a common understanding so that when you're discussing various issues, you understand what I'm talking about. And also just to acknowledge how broad research is. So for me, for you, and also for me, we'll be discussing what health system research is, because research is broad. So when you're talking about health system research, what do we mean and what do we refer to? And also we are going to discuss who are the important people to include in the process, not just the researchers or people involved, but the wider population. But also how do we go about implementing the research proposals or research ideas in the health system? And also, what are some of the issues that we should consider or are recommended to be considered before or during the implementation of health system research? Then I'll talk a bit about my work, my research work that I'm focusing on now. Then next slide, I would just want to recognize that when we are conducting research as researchers, what we have been exposed to, so in terms of our formal knowledge or our formal education, but also our experiences can influence what we focus on. So our experiences could be the work that we are currently doing or the work that we did in the past, or the collaborations that we had, or the funding opportunities that are available then or will be available in the future. But the formal knowledge is also like the education, your background, and the kind of training like one received in the past. Then in the next slide, this slide, I would just like for us to discuss the health system. When we're talking about the health system, what do we refer to? So the World Health Organization came up with 6 pillars. And these are the things that we know them. We know as professionals, we interact with them every single day. And some of them working very well where we are working, and some of them do not work well, or we are seeing some challenges when it comes to these pillars. And so I will go through them quickly, so at least you have an idea of like what they include. So like the first one is service delivery. Second, be what is being provided by the health system, from treatment, the advice that we give to people, could be the preventive services that people are receiving, so that is under service delivery. And that is the first pillar of health system or the health systems. Then we have health workforce. And this is the distribution of health workers, but also the qualifications that health workers have, but also their competencies, or like how well they can implement what they're taught or what they're trained to do. Then we have information. So this could be the information systems, also could be communication, and information sharing in the health system. Then another pillar that WHO has included is the medical products, but also technologies. So this could be like technologies or products helping with like prevention or treatment. They serve other purposes in the health system. Then when it comes to financing, which is another pillar, these are like resources which are available to run the system. Could be the finances available to pay salaries or to buy equipment or to fund research. So all that is under financing. And so then we have leadership and governance, like how the whole system is prepared. Then at the end of the day, we hope that these 6 pillars can help to improve the quality of care. So in terms of how people are satisfied with the care that they receive, the safety, like to make sure the health system is not doing any harm to people, but also the access in terms of how easy can people get the services when they need, but also the coverage. So this is what WHO or the World Health Organization mean by the health system. And it's like, so when you talk about health system research, is what they actually mean. Then the next slide is just to talk more about the health system blocks or pillars that WHO has recognized. So they're actually great because they help us to understand the system, but also to evaluate the health system and also to appraise how good it's working or where the challenges are. But with time, because the pillars were developed in 2007, with time, some researchers or scholars have identified some issues that are missing and should be considered in the health system when we are talking about the blocks or important pillars of the health system. So the first thing that was seen as a weakness is the blocks seem to be very linear or standalone blocks. So there's no any clear interaction, for example, to understand how lack of financing will affect human resource. Because they are all mentioned separately. Then the second weakness that was identified is like the pillars do not talk about the people who are involved in this process. So they could be, we can call them stakeholders, and how they affect the implementation or the success of implementation of like activities in the health system. So in the coming slides, we're going to talk more about the stakeholders. and how important they are in research. Then another weakness which was identified is the people, like the beneficiaries or clients of the health system. They are also not recognized in these pillars because they can actually influence how people accept or reject some services. They can affect even how the research is being conducted, how successful it is, or how eventually it informs policy. So yeah, so those are some of the weaknesses of the WHO building blocks that in researching the health system now, we are making sure that we are incorporating them. So we have talked about the health system, and so we understand as health professionals, we understand like how the health system works. So usually we expect or what we hope is like when we provide a certain care, things will work the way we hope they will. So for example, so for example, for a baby who is sick, we hope that when we provide antibiotics or we investigate the baby is going to be okay. But we have not considered other factors that could actually make the process of taking care of the sick baby complicated or impossible. So the next slide is showing some of the complexities of the health system. So the health system is not as simple or as linear as we think. So the same baby that we're seeing seeking care could have challenges. So for example, getting the baby to the hospital. That's something that is challenging but is not explicitly highlighted anywhere. Or maybe when the baby reaches the hospital, there's waiting time, which could affect when the baby will get the service or the child will get services. Also, the health workers who are involved, how they think or how they're behaving then, or how they feel could affect the quality of care that the child could receive. And also the available resources like drugs or investigations. But also the family of the baby or the child will need to think of how are they going to cover the service, the cost. Is the child insured or not insured? So it's very important to recognize all these dynamics in the health system, and they really help in researching the system and also informing policies to understand how complex the health system is. And so this is explaining more the complexity of the health system. So the WHO pillar focused on the system hardware, like things that we can see. So for example, the finances and the drugs, or maybe the availability of human resource for health. But there are some important parts of the health system that we cannot see, and we are arguing that should be included in health system research. So for example, how the health system functions, things like relationships could be between health workers and patients or among health workers, could be norms, how they do things in the hospital. Maybe they do them correctly or not correctly. The values, how health workers, for example, feel valued or feel their appetite and their mood could all affect the health system. So it's also important to recognize that these actually affect the system at different levels, from the global level to the local level. So research will cover all these areas depending on the focus at that particular point. So just to build on what I just said, this is an example of how the pillar drug and medicine has complexity, because usually when you talk about maybe medicine and drugs, the government will think once they provide enough drugs in the hospital, everything will be all right and people receive the care they need. but actually it's more complicated than that. So the organization of how the medicines and drugs are being supplied, how they're being distributed, and are being reported as well. So this is an example of the medicine and technology distribution chain in Tanzania. So you can see how chaotic it is. It can lead to the confusion in the health system, can lead to also things like duplication, like can duplicate the efforts that are being done because there's no good communication, or sometimes could even contradict the provision of care. So it can also affect in terms of financing, like double financing or time that human resource will have to spend, like maybe filling information. So it's very important to understand that it's more complex than just the provision of drugs or just looking at the pillars of the health system superficially. Then I have another example, which is from South Africa. And so the last example was on the organization of supply of drugs and medicine. But this example is from the pillar information. So usually we think maybe when you have a good information system, everything will be all right and we'll understand the information flow. But this shows the complexity of information flow. How for example, the health system information operates or functions can affect whether the information will be effective or will it be contradictory, will it waste lots of resources because of that. And this shows just how the flow information is in South Africa. Okay, so after just discussing the background of why we need to understand the health system, the complexity of the health system, and how different pillars interact with each other, I think, I'll argue that we need to have health policy and research, or health system research as well. So it's to address the complexity of the health system, but also to unpack it into simple explanations that people can understand, and that can help to inform decision making, but also resource allocation, and is a good way of also monitoring progress. So we have talked about health systems, and policy research. But we understand that research is very broad. I mean, I think most of you are medical doctors or you are medical professionals, and you maybe in your areas or experiences, you have come across like different research which is being conducted. So it's good to understand when you talk about the health policy and system research where it sits in like research, but also evidence and also policy work or information. So we know about biomedical research, so that is like anatomy or physiology, biochemistry research. Then we have clinical and behavioral research. We have like population health research just to understand, for example, epidemiology and other things. Then we have social science research, which is more like anthropology, understanding people, where they're from and why they act the way they do. So health system policy and systems research. So we refer to the research which is conducted at different levels. So it's multidisciplinary. It can include social sciences. So it's like anthropology, like understanding the background of people, why they behave the way they do. Could be population health research, clinical and behavioral research. But it excludes biomedical research. So it's not research to understand maybe anatomy or physiology. It's more research to understand why things act the way they do within the health system. So you can see where health system policy and and system research also sits. And you can see usually when they do biomedical research is at the sub-individual level, but the health system policy and system research will start at the individual level and also at the societal level. And it can be something small, like a macro, or could be meso, or macro, like bigger, like could start at the maybe county level, can go up to county level, or could be research which is conducted in the entire country, or could be in multiple countries. So that's what it means. And what's the scope? The scope of health policy and system research is like research which is meaningful and it aims to inform change. Usually it's not research which is conducted just for publication and it just sits somewhere and there's no any progress. So usually it's just to make sure that it informs something. And that's why it's very important to understand from the beginning, like why this is being conducted and how, but we're going to talk about that more. And so when it comes to policy, so it's where the power sits and also all the politics and ideas sit. So it's very important to understand that these policies, like power and politics and ideas within maybe a certain county or a country, can affect the implementation of the health system. So for example, the hardware and software. Could be an example could be like the politics. Maybe if the government is supportive of a certain policy, like for example, provision of contraceptives to women. If the government is supportive of that, that means that can happen. But if the government is against it, that means even the financing won't happen, distribution of contraceptives won't happen. And so it's very important to link them together, like policy and research, health system, policy and research. So after understanding how they work together and where it sits in the government or in a particular context, it's good to know how we can implement this, how we can conduct this research to inform policy. So the first step is to identify the research focus in question. Just to know what is the problem, or what do you want to address, and how big is the problem, where are you going to focus on, and like why. Then from that you can choose the design of that particular research. And you can also think of like how good the design will be to make sure that the research is of good quality and also is strong, is robust. But I'll talk about that later in terms of like how to choose a research question, and also based on your background or areas that you want to address. And just yes to say, like, the question will drive the study. So what you ask will determine how the process will look like, but also the results and how that will inform policy, because sometimes it can be challenging. If you ask the wrong question, could lead to having a research which might not end up informing maybe a certain challenge that you're seeing, or the right policy that you want to inform. Okay, so this slide is just showing the importance of asking research questions and who you involve in asking these questions, especially us as researchers. Like, because we are not operating in silos, we are within a society which is complex and it involves many people. So when you want to research any particular part of the health system, it's very important to understand people who are already existing in the health system and their roles. So it could be the community groups, could be the patients or district manager. It's just to acknowledge that the researcher will have a certain angle of researching, or the ideas are coming from a certain angle based on their background, but they might not know everything that could affect that system. So learning from people who are already there, who have experienced maybe challenges from a different angle, could help them to make the research robust and more ideal, and also to avoid getting some challenges that could make the research maybe not successful or could be delayed. So this is just to talk more about the importance of asking questions. So for example, what is the study purpose? There are so many reasons why we can conduct research in the health system. Just to recognize, that will also inform the time we spend, the methodology you use, people will involve, and how eventually it will bring results that will inform different policies. In the past, they were focusing more on the normative or the evaluative work, which is just to give generalized answers. Like, for example, why are people not using antiretroviral drugs? But now we are seeing research is conducted from different angles. So some research could be conducted to just explore a certain idea, to explain maybe why there's a certain pattern, or could be, so that is like explanatory, but to explore is exploratory. So there are many ways of conducting these different research activities. And so it's good to understand the purpose, and that can inform you, but it's good also to recognize that it's not just from one angle, like the way things used to be done in the past. Then, so after being clear with like what we want to get out of it, like the purpose of conducting research, it's very important to also recognize actors. So I talked about the actors or stakeholders before, but I think it's good to discuss them further or in details, who these stakeholders are and their role in conducting research. So the actors are like, or stakeholders are like people, or could be organizations, who are also interested in that particular research or that particular policy at different angles, or different levels as well. And they can really affect how your research is going to be successful or it's not going to be successful. And could be people from the government, could be people from non-government organization, could be people from the private sector, could be local people, could be international people, could be the civil society organization. So all these people have to be included in the health system research. I know it sounds a bit different because I think the research that we're used to, for example, a randomized control trial, we're used to, as researchers, we just conduct it and we get results and we don't involve anyone apart from the researchers. But for health systems research, it's very important to recognize stakeholders who are within the health system, because they are the ones who are implementing and they know what is happening, and also the findings are going to inform what they should do next. So they are a very important part of the research. So as I said, you can see there are different parts or different types of stakeholders. So that is in the next slide, please. So there's some stakeholders who are profiting. So for example, the private sector. So you have to know, based on your research question, as you said, and your purpose, But it's just to acknowledge that there are different type of stakeholders. And so once you know your research question, and once you know why you want to conduct that research, you have to think of who will be the correct stakeholders to approach. So is it the private sector? So maybe if it's something to do with the distribution of drugs in, I don't know, private hospitals, of course, the private sector will be very key to include. Also, if it's something to do with the acceptance of vaccines in the community, of course, the community leaders will be very important people to include. If it will be maybe if it's something to do with how health workers are satisfied with maybe what the payment or the environment in the hospitals or where they're working. So it's important to include maybe the organizations of health workers or societies of health workers. So it depends on who you want to involve. If you want to make sure that maybe the civil societies are involved, especially in challenging topics or sensitive topics, so it's good to involve such people who are already maybe doing activism, or they understand some of the challenges that are happening in the health system or on the ground. So this slide, the next slide, we are discussing whether all stakeholders are equal. So all stakeholders cannot be equal all the time. So it's also very much dependent on the research that you're conducting. So we need to assess when you're conducting our research, health system research, who are the possible stakeholders, and how are they influencing the work that we're doing. You can do that by reviewing the literature, talking to people, or just getting the understanding of what is happening on the ground, and that can inform you how to go about involving the stakeholders. So this next slide, I'll show you how you can do the analysis of stakeholders. So this is called the power interest grid. It's I think the slide before that. Yeah, the blue one. Yeah, so it's the power interest grid, which shows so we have the X and Y axis. So there's a power grid and also there's the interest grid. So it will help you to know where to group them and how much to spend time with all these stakeholders. So for example, so we see if someone is very powerful and has also high interest in what you're doing, you need to manage that person closely. So for example, when you're doing a research to understand, or maybe in a pediatric ward, to understand how babies are being taken care of in the pediatric ward. Some of the powerful people who are they have high power, but also they most likely will be highly interested. For example, the nurse in charge, because they are the ones who are there. They know what is happening. They can give a go ahead or can give you hard time, and they can participate in any change that you want to see. So those ones you have to manage closely to inform them from the time you are starting your research, you're implementing, and also the time you want to give them feedback. And there's some, for example, who are very powerful but less interested. So in the same example, maybe medical officer in charge or the head of hospital could be very powerful but less interested because they have so many other things they need to do, or they have so many other priorities. So maybe you can just keep them informed. You understand? You can just to make sure that, or maybe you can keep them satisfied if they're powerful and they have low interest. You can keep them satisfied by just making sure that you have all the right documents needed, you have the approval, and you just inform them of what is happening, but not as much as how you will inform the nurse in charge. And there's some who have low power and maybe low interest, maybe someone within the district who is the district commissioner. So they need to know what is happening in their area, but they don't really want to be involved that much. So you can just monitor them to see whether they will change their mind or they'll feel threatened. But it's good to involve all of these people to understand who is doing what, where and why, and how can I keep them informed. So also these stakeholders can change. So it could be at some point they are very powerful, but they could be less powerful, or at some point they are less powerful but could be more powerful. So for example, if a political leader agreed with a certain research to take place, then later they change their mind, that means even at the end of the research, maybe that policy will never be adopted because they don't really agree with that. So it's good to monitor them, to keep them informed, and to involve them from the time you're starting, or even sometimes even before starting to implement a certain research. So this is an example of a stakeholder map. So you can see this is for tuberculosis. I wonder if you can see the next slide. It's very small. It shows for tuberculosis patient. So usually, like, you're conducting a research on tuberculosis, but there's so many other stakeholders that you can involve. So for example, doctors in the healthcare, you have so many people who can be involved. The support groups, where people with tuberculosis will go for support. You have family and friends, and all these people play key part in this patient. So the family and friends will be the ones supporting this patient, will be living with the patient, providing medication to the patient at home. So you can see maybe they could be powerful and maybe interested, so it could be maybe very important stakeholder to keep close. The doctors could also be maybe powerful, but maybe not very much interested in how the patient will do at home, or maybe very interested. So it's good to know, because the recommendations that will come out of the research will help to also tailor some of the reports, like who do we say what based on how powerful they are. Then I would like to talk about, so we have talked about involving other people, but it's good to know also where we stand as researchers, as who are conducting this research. So that we are not biased, but also we are coming up with things which are relevant and also can really make the difference we want to see. So this diagram, the next diagram, please, it's going to be a bit tricky. Yeah, so this one shows, I don't think you should pay so much attention to it, but I want to show that even when we talk about research, it's very varied. And as, for example, health professionals or medical doctors, sometimes we focus on only one angle of research. So there's the kind of research which we call positivism, which is mainly talking about what is right, what is wrong, the causality of these, and is it statistically significant or not. And so that is kind of research which informs a certain research question. Then there's another angle which talks about why things happen the way they do, the theory, the phenomena, and different realities or ways of getting knowledge. So that can also inform what research we conduct. So the left side usually is to answer questions like what is happening, why, what is happening in the health sector, and usually choose quantitative methodologies. But the right-hand side, which is, we say, social constructivism, is usually about why and how things happen. And usually it uses qualitative methodology. And it acknowledges that we have multiple realities or multiple truths so maybe people can inform us, can give us different reasons why things happen the way they do, and how those things happen. So when you're conducting your research, you also have to know, as a researcher, where do you stand? Do you believe in, like, maybe everything has to be statistically significant, and this is how I want my research to be. Like, this is the kind of evidence I understand. Or you also acknowledge that, yeah, things can happen based on maybe the context and the people involved, and that we can have multiple reasoning. So these are the things I know. In the past, like, biomedical research wasn't considering. It was more about knowing the truth or not knowing the truth. It's like just one way of doing things. But now things are changing, especially after introducing social sciences into health system research. So before, it used to be like, what percentage of people have tuberculosis medication, and maybe, yeah, maybe this percentage will inform how the disease will progress maybe in the next 20 years, maybe when we will eliminate tuberculosis. But now the research is also focusing more on why these people do not had access to tuberculosis medication. What are some of the challenges? So their social status, or the support they have, some of the maybe underlying conditions that are making it impossible for them. So you can see that that's another kind of research that we acknowledge is happening in the health system. Next, please. And so this slide is also showing that, because usually when we want to conduct research, we just want to start with methodology. We just want to say, oh, now I'll have quantitative design, and this is what I want to do. But this slide shows actually thinking of a methodology is not even the first step. It's like
Sorry, excuse me, Ma.
Yeah.
Okay, please, can you improve on your audio? There are complaints that people can't hear you clearly. So I don't know if it's your network or the volume.
Maybe I should switch off my video. Can you hear me now? Hello? I wonder if people can hear me now. Okay. I think it was the network. Okay, so
yes, we can.
Okay, thank you. So this diagram just shows how important it is to, like what I've just said, like how important it is to consider other factors before you even start to think of the methodology of the research you want to conduct. So the diagram is just explaining the process of developing the right research paradigm. You ask yourself questions like, what is good or what is bad, or what do I consider as a valuable research or valuable data when I'm conducting my research? And also then after that, you have to ask yourself, are you an impartial researcher, like you want to know right and wrong, or you are like curious, and things like what is worthy when you are getting your results? Is it the causality, or is it the correlation, or this thing that you want something experimental? So all that will inform how your methodology will be chosen, and also later how you get your results. Okay. Next, please. I think we've already covered that. Thank you. Yeah. So what should we consider in our research? What else? So we've talked about the methodology, we've talked about the stakeholders, we've talked about, things to consider, but I think there's other things we should consider. So I would like to talk about equity and equality in research. So equity is making sure that those who need more are getting more, and those who need less are getting less, just to make sure that there's good flow of resources, or the need is being addressed. But equality is just making sure that everybody is equal and gets things equally. So equity in health research, you can see this diagram is showing, especially in low and middle income countries, some of the challenges that researchers are seeing. So for example, at the individual level, there are some things that affecting researchers. So for example, the education that researchers are getting, is it affecting the way they think as researchers? Or is it empowering this idea of like elite or people who are like more powerful than others? And also the ownership of the research which is being conducted. So in order to build a good research background, but also to make sure that low and middle income countries, especially African countries, have good research, we also have to change our minds as researchers individually, especially researchers who are trained abroad, but also we're working in Africa, but have that mindset of what good research is, where it comes from. Like maybe they don't trust their local researchers or people who are conducting research in Africa. But also organizations, in terms of which organization is funding what kind of research. So there's no real diversity and inclusion in the provision of research funding, or to localize some of the funding. So for example, some researchers in Africa are struggling to get maybe global funding, maybe from the World Health Organizations to conduct research in Africa. And also to decentralize, because some research is usually, you find like maybe institutions in the West are the ones like getting all the data, owning the data, and some African countries are not maybe having that ownership. They're just being included, but they don't have that power to lead in research. And also, it's a time to also make our governments accountable, for them to provide research funding and opportunities, and that can enable research or researchers in Africa to conduct the research they need, and not to depend on developed countries to support them, or to help them in like having like strong evidence. So this is power and the privilege. That is one thing that we need to consider in making sure that we have health system research which is cross-cutting and very strong and robust, and can help to improve health system in African countries. But another thing, the next slide please, another thing is the gender equity. Because that's an area which has been recognized as a challenge. So, for example, lack of political will and commitment to address some of the gender inequalities, and in some contexts, actually, is not even adequately addressed, and there's some gender differences. And gender is usually overlooked in the health system, in terms of planning, but also policy making. So it's good to recognize that gender is not neutral in terms of being included in health system research. And also women's contribution to health and also health system research is something that also needs to be addressed. Next please. And how can we address that? We can improve gender equity especially by involving our leaders to lead the way to things like implementing and funding and supporting for gender equity, to see what evidence is already available and how we can include women, because inclusion of women in health system research is not just for women to be researchers. It could be women as stakeholders. Stakeholders, maybe they are already in the civil society organization or in the private sector, but also women as beneficiaries. Beneficiaries are also stakeholders, so should also be included to make sure there's no that gap, especially in African countries, in researching health system. and also to decentralize power as well. That is something very important. May we go next to where the research fund comes from? Yes, thank you. I think this was also a question in terms of how do we make sure that we have sustainability in conducting research. So it's very important to recognize that research is expensive and it needs resources, but the information that we get from research is even more expensive in terms of like it's valuable, and it can inform policies, it can inform resource allocations, and it can inform some changes which could actually lead to positive outcomes in the population. So in the next slide, you see that the agenda of universal health coverage is ongoing in most African countries, and at different levels. There are some countries which already have reached the presidential level, some at the local level, they're just monitoring what is happening. But that is to make sure that every person has access to health system services. But that is not just access, but without having to pay out of pocket or to pay too much. So like making sure that there's a cover for every person who is living in a particular country. But also it's not just about those people, it's also about the research which can help them to, can help to improve the health system. So the funding should not just be for a person, should also be for like research purposes. So you can see in the next slide, I cannot see the slides though. Okay, don't know what happened. Hello, I think I can't see the slides, but it's fine. Hello, I don't know what happened there, but okay, no problem. But I want to say that in the high-income countries, there is good progress in terms of availability of resources for health services. So 25% of the country budget will go to health services, while in the low-income countries, it's just 10% or less than that. So you can see why also health research is improving in those countries compared to developing countries. I think because I can't see my slide, I think it's okay, because the last slides just give an example of what I'm doing, and maybe you can just look at the example in your slides, so it should be fine. I don't need to present them. So thank you. Yeah, I said I actually concluded the presentation because the remaining slides are just my example, the example of what I'm doing now.
Thank you very much, Ma, for this session. Please, if you have questions, can you just put up your hand so that Dr. Gloria can take some questions. Please, do we have questions for Dr. Gloria? Sunday, Augustine. So Sunday, Augustine, we can start with you, please. Sunday. Sunday, Augustine, can you hear me? Okay, you good from Cameroon. Please, can you take your question?
All right, thank you very much. Yes, my question is regarding, the findings and the feasibility of research project in my country. Because here in Cameroon, we have a very huge challenge. The government at times is even against some research project that, for example, medical students are launching because of the fact that maybe it's not going toward the vision or what they think when they don't have evidence-based approach. So I would like to know how we can really get rid of this challenge and also get fundings, because it seems like the government is not ready to to sponsor our research projects. I don't know how this could be possible, because our health system needs more change, more research or evidence-based practice, but we are not able to make it possible because of these challenges. So I would like to know how this could be really possible, because this is a very huge barrier for young research advocates.
Yeah, thank you for your question. And I think it's very complex. And I agree with you, especially when the government is not supportive of maybe what you want to research. I don't think there's one way of doing that. I think from the government, from the part of engaging the government, I think it's just to keep on engaging the government, like showing evidence why that is important, like from evidence, like why this is a gap and why we should invest, but also involving some champions within the government, because sometimes maybe the ministry or the minister is not interested, but if there's any champion or someone they can engage, it's very important to also use them, but also can use other people who are influential in the country. So for example, the civil society or other religious leaders who also believe in that. So it's just to engage the government from different angles. It's not usually always successful, but also to acknowledge the role of other people in engaging the government to support what you want to do. But also it's very important to show the government how what you want to research can help to inform their policies or their priorities. Because sometimes the government is not supportive because they don't see how that is going to add value. So keeping it in the language that they can understand or they hear is very important. But so it's engaging stakeholders within the country, but also I don't know if the government listens to international stakeholders as well. So just to get funding from the government, but also sometimes it's just lack of enough allocation of funding. I think another very important stakeholder that we are really ignoring in African countries is the beneficiaries, who are like people. So people need to be educated to understand the importance of the government allocating money for research. So that is to get local research, but also in case you get international research or people who are already funded by international researchers, it is very important for them to engage the government from the beginning so that the finding that you get will be valuable to the government, and the government can see how that is important for them maybe in the future to fund the research activities. But it's not something simple. It will take time. It also depends on the priorities of the government. But it's just not to give up. It's just to keep on engaging the government and influential people from different angles. Thank you.
Okay, thank you. I can't remember who asked the question, but I hope your question has been answered. So the next person, Sunday Augustine, if you're ready, you can ask your question. Sunday Augustine, are you ready?
Yeah, I'm ready. Sorry, I'm actually having network glitches here. That's why I wasn't able to ask my question in the first place. Can you hear me?
Yes, I can.
Okay. The aspect that we like her to throw more light is how to design a research study. So I would like her to, if she can outline it or give speaking from citing some example on how to design a research study. So that is my question: how to design study with a relevant example.
Thank you. I know that's a very good question. I think designing a study would depend on what you want to answer. So you first have to know what the problem is or what the challenge is or what you want to add in terms of what is missing. And then to know how you want to answer it. So it can be the same issue, but you want to answer it differently. So for example, the issue of lack of maybe enough drugs in the country, enough medicine in the country. You just want to know. So that is one issue. It's a problem, but how do you want to address it? Do you want to know the percentage of maybe lack of drugs or drug shortage? Or do you want to know why there's drug shortage? Or do you want to know how to improve that challenge? So you identify a challenge, then you identify how you want to tackle or to understand the challenge. So for example, if you want to know the issue of drug shortage, you want to know the magnitude, that when you're designing, it will be that will be your question. What's the magnitude? What's the magnitude of this problem? But if you want to know what is how, that your question will be how and why. So that can inform you which method you use or methodology. Will it be a quantitative to give you figures, or will it be a qualitative to interview people? Then from there, you can say, after knowing whether it's quantitative or qualitative or mixed, both of them, then if it's qualitative, for example, you want to know, do I want to know from people's perspective, or do I want to know from myself going to the field and experiencing it? So that will help you to understand, should it be an interview, should it be observations, or should it be review of documents? So from there is when you can come up with your methods. Then after coming up with your methods, you can say, how do I want to collect this data? So to get this source of information. So, for example, if it's interviews, do you want the interviews to be with health workers or caregivers, and is the information going to be in depth or short interviews, or should open-ended, things like that. So it starts from understanding the problem and how you want to understand that problem, and also when you are trying to understand that problem, also to understand what is already researched, the gaps which are available in that country or in that similar context, and how it's going to add value in terms of informing the policies within the government. So there's this one diagram that I showed, but I didn't explain it very much. So that diagram will inform you how you want to develop your question and methodology eventually. Over.
Okay, one more question, and that's it from Abdullahi Abdulatif. Abdullahi Abdulatif, are you ready to ask your question? Okay, thank you very much, Ma. Maybe Abdullahi is not ready, so anybody that has any question can just send to the chat box and we will send it to the speaker. Thank you, Ma. Thank you so much, Ma, for this session. We truly appreciate the session. We'll send questions to you if there are any more questions.
Thank you so much for having me, and it was nice to discuss with you, and best wishes. Speak soon.
Okay, thank you, Ma. So we'll be moving to the next speaker for today, and I would invite Dr. Ada to introduce the next speaker.
Okay, good evening, everybody. My name is Dr. Ada once again, and I'm going to be introducing the next speaker. But before I go ahead, please, can you see my screen?
Yes, we can.
Okay, we're just going to be looking at 2 quotes. Then we're going to introduce the next speaker. So the first one I have here is research, the distance between an idea and its realization. Then the next one I have is research is what I'm doing when I don't know what I'm doing. Then here are some excerpts from yesterday's session. This one was from Dr. Jonathan Dangana, where he said that the keys to having a functional health system are adequate finance, security, good infrastructure, and re-engineering. Then this one was from Associate Professor Tonya Onyeka, who was our keynote speaker and the one that introduced the session. And she said, we need to establish good research culture by Africans in Africa. Okay, so without further ado, it is my pleasure to introduce the next speaker. He's Dr. Anyebe Joel Ifenna. He's a medical doctor who graduated from the University of Nigeria in Nsukka, who has been awarded a Pandemic Tech Innovation Fellowship to support his work creating the Lion Science Park Health Hub at the University of Nigeria in Nsukka. Launched in October 2020, the Lion Health Hub is an initiative aimed at stimulating and facilitating students to develop and implement innovative solutions to community health challenges. As part of his fellowship award, Pandemic Tech provided support for the Lion Health Hub kickoff event. The healthcare tacton focused on COVID-19 response, mental health, and reproductive health. Anyebe is a passionate entrepreneur with experience launching industry-first disruptions. He has received both national and international recognition for his efforts to promote health innovation in Nigeria, including the Nigerian Information Technology Development Agency's Office for ICT, Innovation and Entrepreneurship Award certificates, and Ashoka Foundation Certification Award, and an award from the National Economic Summit Group. His multidisciplinary background in medicine and business development has allowed him to engage in the development and commercialization of several products and services that optimizes public health, productivity, business growth, and social impact. He'll be taking us on health innovation and young people in Africa. So please, with a warm welcome, let us welcome Dr. Anyebe Joel.
You're welcome, sir.
You're welcome. Dr. Joel. Okay, let's see what's happening.
Yeah, hello. Good evening, everyone.
Good evening.
Thank you so much, Dr. Ada, for that introduction. At some point, I was wondering if it was me they were introducing or someone else. I remain my humble self, Joel Anyebe, and it's really been a pleasure to have been invited to give a talk around health innovation in Africa as regards young people. I created a very simple slide presentation to just capture my thoughts, because I would be using myself as a case study to discuss the topic. So please, host, can you kindly enable screen sharing?
You can go ahead now.
Okay. Please, can we confirm that my screen is visible?
Yes, you can see it.
Okay. So while creating my presentation, it was somewhat of a daunting task to really condense my thoughts around health innovation and young people in Africa. Primarily because at its core, innovation globally has happened without or with little contribution from young people or people generally in Africa. So the question I asked myself was, what are the pathways for the inclusion of young people in innovation that would directly impact healthcare strengthening on the African continent, using my own personal journey as a case study. So I'll start first with my understanding of innovation. Essentially, a path to creating something new or to improve an existing pathway. And when we think about innovation, we shouldn't think about it from an overtly complex perspective. Innovation could simply be a new way, for example, in medical documentation, a new way for history taking, a new way for medical education structuring, a new way for medical examination, a new way for test delivery or discovery. It doesn't necessarily have to be the design of a new medical device such as the CT scan or the MRI, or the application of advanced technologies such as artificial intelligence in the discovery or identification of patterns that can help with drug delivery. It can be as simple as finding a new way to do an existing job better. And while creating this presentation, this young man came to mind, Chidebere Ibe, who is a self-taught medical illustrator. And while pondering going into the medical field, thought about the disadvantage of Africans being taught in Africa, medical anatomy, especially ones referring to, dermatological lesions from the concept of a Caucasian skin background. Very often when we look into dermatological slides that we're being taught with, it is with the skins of white people. And it can be difficult to mentally correlate when you see a particular lesion on a white man's skin to when you see that same lesion on the skin of your fellow Africans. And that disconnection can impact your ability as a clinician to quickly spot, diagnose, or even treat lesions as they present. So he took on that challenge head on, having a background both in artistry and a passion for medicine, to create documentations and designs that are unique to people of the African race. So that pathway of rethinking medical innovation or medical education is his own innovation. And then it is in that context I want us to really absorb my humble presentation today, to think about within my personal capacity, with the skills that I am either naturally gifted or acquired through patients, how can I impact, by any measure, an improvement or discovery of a new path or the improvement of a path within the African health ecosystem? Because it is in that process that you as a young person is directly improving healthcare. And when we look at it from a broader perspective, as of the last estimate from a consulting firm called Silent Advisory, there were at least 1,276 African youth-led health organizations building capabilities to plug in all the gaps within the African healthcare supply chain or the African health delivery chain, everywhere from digitizing paper records to improve the availability of digital data that can inform data-driven decisions within hospitals and on a policy level, to ensuring that we can temper the effect of immigration of doctors by leveraging telemedicine to deliver healthcare services across distances, to supply chain management, improving the availability of drugs and medical consumables at the last mile. We've seen young people deploy innovations such as drones, deploy tech-based innovation that are software-oriented in inventory management systems to help pharmacies predict shortfalls of drugs, and as a result, get supplied before those drugs are out of stock. We've seen, particularly during COVID-19, where telemedicine companies were able to leverage the power of smartphones and mobile devices to ensure that people still remain healthy at home. We've heard a lot about companies such as LifeBank with a dedication to improving access to essential consumables such as air or oxygen, blood, and blood-related services. All these different youth-led organizations are in their individual capacity trying to evolve new pathways or improve on existing pathways such that holistically the healthcare system within Africa is more resilient. So I talked about, as a young person, what is your role within this giant organism called African healthcare delivery ecosystem? Sometimes it might be hard for a single thread in a tapestry to really understand its purpose. But essentially, collectively as young people, it is naturally our mandate to advance the status quo in a positive direction. It is imperative to stress the positive direction because you can in fact advance the status quo in a negative direction or maintain the status quo, which also is suboptimal. But advancing the status quo in a positive direction is naturally the mandate of the younger generation. And we are burdened with this responsibility, and I dare say that we are more equipped right now than the generations before to address all the complex challenges facing Africa's healthcare system, simply because we have access to more resources. We in truth have an unprecedented access to resources. In today's day and time, you can create an account on LinkedIn, a world-renowned networking platform, and reach out to world-renowned academics in different and diverse fields in the medical ecosystem to directly learn from them, to directly challenge them, to ask them questions. I'm very glad that Dr. Tony Onyeka is on this call. She has a LinkedIn profile. And then if peradventure you have heard her speak somewhere and you were thinking, oh, that is a wonderful clinician or a wonderful researcher, and then because of the lack of proximity, you weren't able to get across to her to get her contact. If you were existing or if you were living, say, 10 years ago, you would have lost the opportunity perhaps to have ever met her acquaintance. But in today's day and time, with a simple Google search, you can find her and then you can contact her and then you can establish rapport with her. That is unprecedented access. Now, when we also come to accessing free knowledge, YouTube is an amazing resource platform in the sense that you can essentially learn so much as a medical practitioner or in whatever capacity you want to contribute. I dare say that for most of us during the course of our undergraduate years, must have at some point in time leveraged free academic resources on YouTube, either to learn concepts that were difficult using textbooks, or to expand our understanding of contexts that we have digested. Either way, before now or before the existence of YouTube, it was difficult to really see medical concepts being explained or access resources being explained in different dimensions. With more than 3 billion contents available, there is literally no excuse at any point in time to say you can't access the first step as a resource to equip yourself in a particular process or a particular path to understanding a process that you want to equip yourself in. And layered upon YouTube are a plethora of e-learning platforms, some of which offer free courses, some of which have requirements for payment. Be that as it may, you can now access high quality educational content remotely. Prior to our age and time, this required traveling over very long distances to access these kinds of medical knowledge, or these kinds of knowledge that can impact your ability to make a change in your locality. And lastly, because of the context of the presentation, ResearchGate and Google Scholar is a good mind when it comes to accessing knowledge from past researchers that can inform or guide your thinking process about a problem. it is very essential that we learn how to leverage each and every one of these resources. So take, for example, the case study with Chidebere that we just made mention. If perhaps he had wanted to initiate the development of a new type of Frank Netter's atlas, he has access to LinkedIn to get into contact with as many medical illustrators within and outside Africa as he wishes. There are several contents on YouTube that can guide with medical illustration and the steps to get started on medical illustration. There are several e-learning platforms with very high quality content that can expand and deepen his understanding of medical illustration. And then going to ResearchGate or Google Scholar can really give him an idea on the impact of poor visualization in the local context of clinicians, especially in disciplines that are, that require a lot of visual imagery, for example, in dermatology. What I see that in my own personal experience, the majority of the challenge is usually summed up to poor consistency amongst young people. That will to dedicate yourself to a particular line of thought, or to dedicate yourself to a particular path of personal development is always a challenge. But given the fact that as a young person, you are battling with quite a plethora of complex emotional and life challenges, it can be very difficult to forge ahead or map a plan and stick to it, given all the noise around. So I had to look within, or had an introspection to really ask what were some of the things I did to help maintain a consistent progress with regarding equipping myself to add value as a young person within the African healthcare ecosystem. The first is a decision to undergo self-driven knowledge acquisition. You have to decide that you are passionate about a particular line, you're passionate about a particular problem, you are dedicated to discovering or advancing the solution of a particular issue. And in that resolve, you seek knowledge about that problem, about that issue, and read as much as possible. At the time when I really got involved with software development and its application within the healthcare ecosystem, I first came across a WHO document at the time around mobile health technologies and its application in advancing and accelerating healthcare delivery in emerging markets. It was about a 77-page document, and I could remember voraciously reading that document page after page. And it was with the different exposures in terms of content in that document that I was able to find more resources, more people that I reached out to, and the chain reaction ignited from there. The second thing that is imperative is to be resilient with establishing mentorship and to define the goals for what you intend to be mentored on. If you want to advance the body of knowledge within the African health ecosystem, perhaps you feel that our utilization, whole line and sinker of medical knowledge created in Europe and in America does not fit local context, and you want to be a world-class researcher to develop knowledge that is unique within the African context, then it would make sense to find yourself a public health physician who you would actively be under mentorship with. And the onus rests on you to define what your personal progress growth looks like. In essence, defining your key performance indexes. From the point where you were able to establish a mentorship journey with an individual, what were your strengths and what were your weaknesses? And over X period of time that you have now been under mentorship, you reevaluate your progress. Has your strengths improved? Have your weaknesses diminished? If at any point in time there is a consistent improvement, then you know that your mentorship is objective and productive. But if there is no improvement, then it's either you are the problem or the pattern of mentorship or the mentor is the problem. And lastly, in this age and time, because of the nature to which problems exist, it is almost impossible to find a unilateral solution to current available challenges within the African health ecosystem. And that is why it is extremely important to build complementary skills. I've always understood that the business of healthcare is what mandates sustainability of healthcare. If a hospital cannot, in essence, generate revenue beyond its cost, or find any means of generating revenue beyond its cost, that hospital is bound to shut down, or that establishment is bound to shut down. So the question was, how can I now build capacity in understanding the principles of business and how that can be uniquely applied to health organizations to ensure sustainability? The pathway of equipping myself with all of these business principles has been a very long journey, but it is the marriage between the acquisition of these skills and my medical background that gives a unique perspective on how to forge ahead. So if, for example, you want to be a researcher, it goes without saying that you should equip yourself with analytics tools. There are a plethora of them available, but you cannot be, or you cannot aspire to improve the body of knowledge and solely just be a researcher who constantly outsources his analysis. At some point in time, it is imperative that you build complementary skills to support your journey. And I wanted this to be a very interactive session. That is why the slides are maintained to a very short number. And I wanted to end on this note. It's a very interesting quote that says, every system is perfectly designed to achieve exactly the result it gets. The healthcare system design in Africa and the outcome of poor healthcare delivery, very available within Africa, is a direct correlation with how the healthcare system is designed. So if we want to improve healthcare delivery, if we want to improve research, we want to improve the body of knowledge, we want to advance healthcare outcomes, we want to get better indices, then we must rethink about the design of our healthcare system across all the various sectors. And then it will take committed young persons who have decided to be dedicated and consistent, leveraging all the available resources under the guidance of a reputable mentor to be able to move the status quo from the poorly designed system as it is to a one where the 1.4 billion persons living on our dear continent can enjoy healthcare delivery at its best. Thank you so much. And you can ask your questions or give your comments.
Okay, thank you very much, Dr. Joel. Please, we'll be taking the questions now. So if you have any questions for Dr. Joel, kindly raise your hand so that we can get right into it. Okay, so Mark Odachi, please, can you ask a question? Please unmute yourself and then ask the question.
Okay, I've done that. My question is, how do we spoke of mentorship. So how do we pick a mentor? How do we know that this particular person is the right mentor for a particular field of research in which I'm going to? And is mentorship always free? So that's my question.
Okay, yeah, thank you so much for that question. The choice of a mentor is dependent on the natural line you see yourself towing as an individual within the healthcare system. So it depends on what you're looking for. If you have clearly defined what you want as a person, you can find someone with expertise in your close environment or within proximity to you who has to some level achieved where you are heading to. And depending on your manner of approach and your eagerness to learn, you can approach and request for mentorship. Oftentimes you will be turned down, but the onus lies on you to keep on requesting from as many persons who match your concept of the end result or the path to the end result of where you're headed. And you don't take no for an answer. So the more you get no's, the more you keep asking, and eventually you would find someone who will take you on and mentor you. I hope that answers your question.
All right, okay, thank you very much. The next person here is Yoguada. Kindly unmute yourself and ask your question.
All right, thank you very much, sir, for your amazing presentation. I have really learned some amazing tips today, and I hope I will be able to implement them in my own case to improve health systems in my country. So my question is going toward the third point that you mentioned. For us, I mean, to be able to take actions, like to really build some skills as maybe medical personnel or medical doctors, we need to have complementary skills to be able to perform that. So I would like to know, like in my own country, for example, trainers, I mean, those who are training medical students or training future medical doctors, they are even the ones that at times they feel like they are challenged by their students. I mean, how can just a medical student will think about how to shape or change the health system when you are still a trainee, you are still on the process? So this is a real challenge that we are facing in my country, because it's like they don't even want to mentor us, even to try to understand the importance of medical students' involvement in research. So I would like to know, how can we really emphasize on that, and so that we can bring them on the table and let them understand the need that the future generations has to do, because it may fall on open our hands to make a change so that we cannot, move on the same way we used to.
Okay, great question. You can get mentored by somebody remotely, and you can get mentored by somebody in person. If you have tried to your personal limits, and although how rare that scenario would be, found no one, absolutely no one who within your local environment wants to take you on and mentor you, go online. There are people from your country who are well established outside your country in the healthcare field. You can find them. They have research profiles. They have LinkedIn profiles. You can get their emails. You can reach out to them, and then you can explain what you're trying to achieve or your confusion on the path to take in achieving what you want to achieve. And you constantly do this until you get someone. At the point when I started looking for mentorship, you would keep on speaking with a lot of academics, and very often they are very busy people. So if you have not shown any signs of consistency that I want to really learn this thing, and I think that you are the best person, or having looked at your background, you are a pivotal person to help me get to where I'm going to, and you constantly remind them and then follow them up, at some point in time, they would bow to your resilience. If you have sufficiently done this within close proximity, within your country, and then you have found no one, look elsewhere. There are people from your country in other countries, in possibly advanced climes, that are keen to connect with somebody who is as passionate as you are, looking beyond all the challenges that he or she has faced in getting mentorship in the local environment to now try to get mentorship from somebody far away. So in essence, what I'm trying to say is you cannot afford to be weighed down by your local community. You cannot afford to give up simply because you have tried within your local environment and it's yielding no fruit. You must, at every point in time, maintain that hunger, maintain that passion, and you would eventually find someone. So that is my response to that question.
Okay, thank you very much, Dr. Joel. Please, before we continue, we just want to take we have question in the chat box. So before I allow Kelvin to unmute, I'm just going to ask the question. The question is from someone in WebEx, because there are some people watching from WebEx, so they send their questions here because you've exceeded maximum capacity on Zoom. Okay, so the question is, it goes, thank you, Dr. Joel, for a good presentation. As a young person, you mentioned we have to shut down a lot of noise in order to be consistent in achieving our goals. How do you suggest we do this? This question is from Ede Ifeanyi.
Okay, so thank you, Ede. Solitude. You have to develop that intentional need to seek solitude. It is very difficult and often impossible to plan as a young person, given all the noise. Solitude could be a particular environment where you go to work far away from your immediate environment. Solitude could be a group of people who share your visions and your life and your aspiration. Be that as it may, you have to define and find that environment that enables productivity. In my personal case, during the undergraduate period, I was fortunate at some point to stay alone in my room. It was in those periods that I amassed a whole wealth of knowledge. So at some point in time in your personal capacity development as a young person, you have to detach and map your own plan moving forward. Find your own tribe, find the community of people who share your vision. It could be on an Instagram group, it could be on a Facebook group, it could be on a Telegram group, it could be on a WhatsApp group, it could be in Twitter, it could be anywhere. Find them and you build with them. It was in my time of studying in solitude, developing myself personally outside medical skill acquisition and education, that I got to discover a lot of like-minded entrepreneurs within the African and Nigerian healthcare ecosystem, some of which are building amazing companies today. You have the likes of those building electronic health record systems such as Helium Health, those building at Life Bank, those building systems that power even federal ministries. But at each point in time, looking back at their own journey, for those who had a passion to leverage software, they had to evolve program skills. They had to learn software development, and they were consistent. So in between going for postings, coming back to postings, or whatever their own medical curriculum was, or the curriculum for where they were studying, they found a time to isolate themselves and equip themselves with that skill that they needed to solve the problem that they were passionate about. So solitude, again, I resonate, is the answer. Detach yourself. Map out all your time from in a 24-hour cycle. You sleep from X to X period. You are engaged at work or at school from X to X period. The other Y period that you seemingly do not know what you do with that time, dedicate a certain percentage of that to just disappear, to build yourself. Thank you.
All right. Thank you very much for that answer. We're going to be heading on to Kelvin. Kelvin, you can ask your question now. You can unmute yourself.
Okay, thank you very much, ma'am. And thank you, Dr. Joe, for this presentation. I have been having this issue of marrying my passion, like the area I want to focus on, with the kinds of problems I see around me. So I want to know, how can I, say for example, I'm a dental student of the University of Nigeria, Enugu campus, and most likely my line is going towards dentistry, and it's like the options I have are just between the surgery, the oral maxillofacial surgery, or maybe restorative, or whichever one of those departments that I will have to focus on. So for the problems I see and I am passionate about solving are not necessarily within that sphere of any of those departments now. So like how what's your advice on one that wants to marry both his work now with his passion, like with the problems that he wants to seek out? Or is it that is it that I will have to, like, at a particular time drop those other works and then just focus on the problem and then build and solve it and build with that? Or will I still have to hold on to my the work that any specialty I want to go into? So I want to know, like, what's your advice on that? Thank you very much.
Thank you for that question. At some point in time, everybody was faced with such a personal question, but there's always a subconscious intersection between what you're passionate about and what you're currently committed to as a career path. It would really take a lot of introspection for you to find what that nexus is. I've always known that I was a creative person. I liked abstract concepts. I liked physics. I liked medicine, just anything that stimulates the mind. And that is essentially what problems do. So given the fact that I was already committed with building a career in the medical ecosystem, I had to apply that inclination of problem solving within the medical context. So what were the problem, or where were the problems that excited me within the medical ecosystem? So I don't have full visibility on what the other aspect of your passion is. But if it's something that you developed while building your career, while undergoing your medical training, it is possible that there's a subconscious intersection. You just have to search wide enough and far enough for what it is. At the point when I started solving or looking for the intersection between business, development, or innovation in healthcare system, I didn't know what entity could sum it up. But now you have people who are bioinformatics experts, who have an MD or an MBBS. So they are very often very clear career path that you are unaware of, probably because you haven't yet dug deep enough. So you have to do that search. You have to ask yourself, what I'm passionate about and what I'm committed to. What are the synergies? You might not have all the answers, so it makes sense to talk to people who are experienced in both fields. For example, there is a young man on Twitter who is very good with artistic designs. So he does a lot of painting work. And the application of that in the healthcare sector was medical illustration. So he could give breathtaking anatomical designs. Now, he probably was wondering, how would he evolve his capacity to materialize unique designs on paper? How can he build on that as a doctor? But there are emerging fields of assisted learning in the medical ecosystem. Surgeons are being trained with augmented reality and virtual reality systems. And these systems are based on softwares that essentially produce three-dimensional artistic images of the anatomy of the human body. So somebody who has a background in medicine and a talent in painting is at the intersection of what such a company would be looking for. So he or she can just have an advanced degree in public health or in bioinformatics or any other information-related sector or information-related discipline within the medical sector, and then go into the private sector. He can apply and work with these companies. 3D modeling is a new field now in the medical system. People are trying to evolve body parts that would not be rejected using the tissue gotten from the host. There is a particular designer who does prosthesis and does hyper-realistic prosthesis. You can Google this. He's a Nigerian. I've unfortunately forgotten his name. His prosthesis are so natural or look so natural that they're almost indistinguishable from an actual human limb. He is at the intersection between art, medicine, and engineering. So to sum it up so that I can potentially take more questions because of time, ask yourself, what might be the connection between what I am committed to and what I'm passionate with? If the answer is not immediately apparent to you, go and ask questions. Ask people in the dentistry field, how can somebody who is passionate or with skills such as this, how can they advance their career as a dental surgeon or as a dental practitioner? Then you go to the other side, the people who have more experience in the thing you're passionate about, and ask them question, what are the applications of this particular skill or this passion? When you ask enough questions and done enough research, at some point in time, the intersection would be apparent to you and you'll be able to forge a plan forward. Thank you.
Okay, thank you very much. At this point, I think we can take just one more question. We have a few other questions in the chat box, but I think we'll send them directly to you so that you can respond and then let them know. Okay, so the last question is, let me open the chat box. Sorry, just a moment. Okay, Dr. Joel Edeifani says, thanks a lot for an inspiring answer, Dr. Joel. Okay, so the last question is from Anastasia, I think so, yeah. Anastasia Ekwedike. She says, thank you, Dr. Joel. My question is on your ability to cope while focusing on your project. Did you resign from your job or you were working and doing your project? Seriously, some jobs are so tasking that one is not even able to do more of personal stuff. Okay.
There's always a saying that you don't ask for a seat on the table. You earn the seat on the table. If you have a job that you are doing to meet ends, there are periods of time when you are not involved with your job, say the weekends or off hours. It is your responsibility to utilize the time outside of your work period as a leverage to get a step closer to your personal goals. I mean, this is a story as old as time where you are stuck or you are committed with something that you cannot leave immediately, but you are heading somewhere. There's a very famous scientist, Albert Einstein. He wanted a job when he graduated, although he graduated with poor grades. He wanted a job to teach physics, but he was rejected. So he went to the patent office and was working as a patent officer. And it was in the time when he was working as a patent officer that he had spare periods to really ponder about very thought-provoking physics concepts. He didn't say, oh, because I couldn't get a job as a physics lecturer, hence my career, or I'll just forget about building myself as a distinguished physicist. Another example, there is this very, very outstanding mathematician called Ramanujan, who all the way from far remote India was able to, with nothing but just manuscripts, evolve very complex and inspiring mathematical equations. He did that during off hours, worked multiple odd jobs, but went home and studied under the lamp. So the summary of what I'm trying to say is, your job is taxing and demanding, but what is the cost of losing your dream, of vis-a-vis giving in to the fatigue of your job? When you weigh the two, if it is not motivation enough for you to have more energy when you get back home to keep on working on your dream, then maybe your dream is not inspiring enough for you. But I think your dream is inspiring enough. So if it is, map a plan. I'm working X to X period. From the point when I stop working with my employer, I can take X period of time as break. And then this also time, Some people have decided to work 1 to 3 a.m. Some wake up by 3:30 and work from 3:30 to 5 a.m. before they go to their employers from around 8 a.m. So it all depends on you. You know your personal schedule. You know where you are headed. And there is nothing that will take you there other than sacrifice. Thank you.
Wow, that was very deep. Wow, okay. That was a very wonderful response. Okay, so the Dr. Gamba is pleading that we take one more question and then we'll wrap it up. So the last question here, it's from, sorry, let me just get to it. It's from Jehu Census. It says, thank you, Dr. Joel from Jehu Census. Innovation is fund-driven. Is there any fund assistance platform for fresh medical graduates to actualize such ideas?
Yes, I'm glad Dr. Tony Onyeka is on this call. She is an amazing resource. Please hold her. I mean, if you see her anywhere, hold her limb, up and lower limb, let her not go. All of you should directly follow her, and then in short, to the limits of her capacity, request mentorship from her. She has been able, throughout the course of her career as a researcher, written multiple successful grant-funded research. So yes, as an early stage researcher, there are a lot of opportunity, both within Nigeria and then even outside Nigeria. So the NIH has, early stage research programs, even within the Center for Translational and Implementation Science within the University of Nigeria. There are pathways for early stage researchers. And these things can be found when you do research. So when you do research, use keywords such as early stage researchers or early stage software developer, or early stage medical innovator. You can in fact find pathways that you can take. Then if you have an interesting solution to an interesting problem, there are a plethora of what we call incubators. So an incubator, just as the word implies, is a program that helps nurture an idea from just a concept to something with more structure that can get or attract more funding. There are incubators that are particular to health solutions. Even the World Health Organization African region has an innovation hub, and they usually have requests for applications for innovations within Africa that can be accelerated and adopted by various African countries to solve different kinds of challenges. So Google WHO Innovation Hub, UNICEF has an innovation hub. In short, most development partners have some form of program to guide early stage development. Then you can also research around incubators. But if you're going the line of an incubator, then you have to equip yourself with some rudimentary knowledge of business development, right? So you have an idea, you have the problem it is intending to solve. You must really understand, okay, who are the stakeholders for that idea? So these are the things that you can learn, this what we call the business model canvas. So really put a structure around your solution that can help you attract either private or public sector investment to move the idea from concept to actualize the potential within the idea. So in summary, hold people like Dr. Tony Onyeka. If you can reach out directly, Dr. Mbajogu, Ada is here, hold her by her hair. You can hold Dr. Nzubechuko Ogamba. They would all they can help you get access to these people. So that is that. Google about the WHO Innovation Fund, Google about health innovations, and then health incubators. And then with all that studying, you'll be able to find a path that is unique for you and that makes sense for you. Dr. Ada, I think you're on mute.
Okay. Okay, so thank you so much. Thank you. It was a really thought-provoking session. There was a lot to gain, a lot to learn. And yeah, we're very grateful to have you, Dr. Joel. And I think they should hold you too. So I think if you're wise and you're smart enough, you hold on to Dr. Joel as well. You can follow him on LinkedIn. He's on LinkedIn, and yeah, for more details. I'm very sorry if we couldn't take your question. Okay, I think we have one more, but because of time, we have to wrap it up here. I'm also sorry to the person that sent a question for Dr. Gloria. Unfortunately, she's not on the call anymore, but we'll get back to you with your answer. So thank you so much, Dr. Joel. It was an honor having you here. At this point, we're going to wrap it up. But before we do, please listen to the following announcements. So we've come to the end of the second quarterly summit. It was a wonderful time. From yesterday, our keynote speaker, Dr. Tony Onyeka, when she launched the session, it was very wonderful, to Dr. Jonathan Dangana, to Dr. Gloria this evening, and then Dr. Joel. It was a great time. So please, certificates will only be issued to people who fill the Google form, and the link, the Google assessment form, the link is on the chat box. It's not to people who registered. We're not going to issue certificates to those who just registered or joined the WhatsApp group. It's only to those who fill the Google form. That's those that are on this call. The Google form won't be posted on the WhatsApp group, okay? So please, if you've not filled it, this is an opportunity to fill it now so that you can get your certificate. So at this point, I'm going to be calling on the organizing committee chairperson in the person of Tochukwu Promise to please give his closing remarks on behalf of YOHAN. And please feel free to follow YOHAN on all our social media platforms, on Facebook, on Instagram, on LinkedIn, on Twitter. We are active there. If you have interest in joining the YOHAN community, please feel free to send a DM on any of those platforms, or to me, or to Dr. Gamba, or to anybody you can reach that you know that is in YOHAN. So yeah, thank you very much. So Toshku Promise, please kindly unmute yourself for your closing remark. Let me give you access. So unmute yourself. So on this one.
All right. Good evening, everyone. Hope you guys can hear me.
Yes, we can. Good evening.
Okay. So it's been a pleasure. The Nigerian in me will not allow me not to say more without.
Please feel free.
It's been a lot of exposition and learning, relearning, and so I from the thing that we've talked about today, I see the need for mentorship when it comes to research, and giving it your best push when you want to really do it. Because at the moment, as a Nigerian, I'm talking as a Nigerian, there are so many things we are doing that is taking our time, that most times research feels like a side thing. That's from my experience, feels like a side thing. But when you really want to make it something you want to really be serious about, you have to give it 100% of what you've got. And from experience, I can tell you, it always pays off. It always pays off. When you see your name published on one journal like that, it always gives you a certain kind of pleasure. Let me use that word. So thank you so much to YOHAN for organizing this beautiful summit. It was a pleasure having Dr. Gloria and Dr. Joel talk to us on the topics that they did. I did learn a lot. It's a lot, and I would encourage the participants to, whatever that you've drawn out of these things, do not let it just be another summit that you've attended. Let it be worth it this time around. Let it be worth it this time around. And YOHAN is actually organizing a 2 weeks research training. If you would want to join, it's also an opportunity for you to learn at a subsidized price. Like it was mind-blowing when I saw the price. But well, let me not take any of our time. The last thing I want to say is please do not be in a hurry to leave the WhatsApp group, please. At least for this week, because we'll be using the WhatsApp group to pass out some messages that will be needed, that that you will need to know, some things that you need to know, so that you don't miss out on those information. So just hang on there for a little while. Don't be in a haste to leave the group. So yeah, thank you all. Thanks everyone for being here. I truly enjoyed myself. So back to you, Ada. Thank you so much.
Okay, thank you, Tochukwu. Precious, not promise, please. Forgive me. Okay, so before we leave, I just want to thank the leadership of YOHAN, from the CEO, Dr. Ogamba Uzbechukwu, and every other person that was involved actively to bring this summit to become a thing. Thank you so much for the opportunity. To my fellow co-host, Dr. Dubin, I think you should come on and say farewell to our attendees. Thank you so much for having us. Dubim, are you still there?
Yes, I am.
Okay, so
Thank you to the participants. Like, the interest was also encouraging. So, you know, when your host, when you see that participants are really interested, to just like encourage you to keep going. And then the speakers today were really good. I thank Dr. Joel, Dr. Gloria, and my co-host, Dr. Ada. Thank you, Dr. Nzube. Thank you, everybody. This has been a really rewarding session. Thank you to the organizers.
Okay, so thank you, everyone. Thank you for making this hosting thing easy for us. Thank you so much. Like I said, the interest was crazy. Thank you so much.
Someone just reminded me. Let's
Okay.
on our videos.
Okay.
Did you
Dr.
hear me?
Gamba, we didn't hear
Yes,
you.
let's take a picture. I said, can we take a family picture? Someone just reminded me.
Oh, okay. Someone said family picture. Please, if just turn on your videos if you don't mind. Let's just take a quick one. Can just take a screenshot, please. Okay. A few more people, please. Just hold on to that smile. I can see Tochukwu Precious smiling. Okay. Okay. So let me take. Please also help us by sending these screenshots to our WhatsApp group so that we can see. Someone says no lights, no problem. So smile. We're about to take it now. Okay, so wait, just a few more, please. There are a lot of people. Wow. Oh, okay. Okay. Okay, so thank you very much to everyone. It's a wrap from here on out. I wish us well in our various endeavors. And please, if you've not heard of the 2 weeks training, the organizing chairman talked about it. We have a research intensive 2 weeks training coming on. We have seasoned speakers and people that are experienced in research, and we'll be given opportunities to dive into research, and touch it and actually, handle it physically, not physically, but you get. So thank you so much for being with us up till now. And from all of us at YOHAN, we wish you a lovely evening. Bye. Please don't forget to fill the forms before you leave. Your certificates depend on it. So see you next time. Bye. The link for the forms is on the chat box. Please do not leave if you've not filled the forms. Let me resend this. So this is fine. Edwin, your hand is up. Do you want to say something, even though we have gone?
Okay, it was the link I was requesting for, but you've done it already. Thank you very much. Thank
All
you,
right.
Mo.
I'm about to end the meeting. I don't know if anybody else has not registered. Not filled the form. Please fill the form. In the next by 7, what's the time? 7:37. I'll end the meeting, please. Please note that these forms will not be sent to the WhatsApp group. Please, if you haven't filled the forms, fill it now. The meeting will end in 1 minute.
Okay, Ada, you can end the meeting. Let me just send it to him directly. I don't know.
I should end it. What of this was saying on the group chat that the forms have not been filled?
I think it's just one person.
Okay, I'm ending it.